Storyline. I'm Patricia Trenchak. COVID-19 has greatly impacted our country's most vulnerable, the elderly and disabled, causing many in this segment of the population to choose home care instead of nursing homes. New Jersey's personal care assistant program keeps thousands of seniors and disabled safe instead of in nursing homes, where 44% of COVID deaths occurred over the recent months. The problem is that state funding for the PCA program is low, despite costing the state significantly less than being in a nursing home. And the demand for home health care is high. Many home health caregivers are leaving the field because the pay is so low, especially given the demands of the job. Michelle Biziacci is here with us today. She is the grandchild of two recipients of New Jersey's PCA program, as well as an associate director with Bayada Assistive Care. Thanks for joining us, Michelle.
Thank you for having me.
Well, you have firsthand experience of this, both as a family member and as being an associate director with an assistive care facility. Can you give us a little bit about your background and experience in this realm?
Sure. So as you mentioned, my grandparents are recipients of the New Jersey State PCA program. They have been for quite a bit now, I would say over 10 years, and they greatly benefit from the help that they receive for their home health aides, especially as they're getting older. So we are very grateful for everyone who's helped us in their care, and especially in the recent years. Um, I've also have a background in working in nursing homes, so I've been in that. I've had that experience as well, um, but mostly now in home care.
Also, there is an issue at hand, as we briefly mentioned. Can you explain how how things are going with the PCA program and the state and the funding?
Sure. So right now we are looking to help our home health aides, our valued home health aides, um, receive the wages that they do, especially during COVID, right? We've seen um, tremendous, I mean, COVID-19 has had a tremendous impact in healthcare in general. So people are now looking to stay home more than ever, instead of going into hospitals or a facility. So we want to keep them here. And the way to do that is to have support from our state, to help increase the, the wages, and the reimbursement. And that would lead to our keeping those great home health aides with us instead of them going into retail, right? They're paying more in retail or going into another industry that is not healthcare. So we want to keep them here. We want to keep those great valued essential workers who have been there since the beginning at home taking care of our loved ones.
I actually have personal experience with this because my child is in a PCA program, and recently her home health aide has cut down her days because she has to go take a job at Target. So I have firsthand experience and I can empathize with the whole program and the situation at hand. So how is the PCA funding impacting the disabled in the community?
It's impacting in part, like I just mentioned, that people are leaving our industry and we're losing valuable home health aides that have been with us sometimes for years now, but they have to move on, I guess, for their families, and things are definitely harder now than it has been. Um, but the impact is, it's just like it's also impacting with COVID-19 our inventory, right? We need to be able to provide, so that funding impacts that. We need to be able to keep up with our PPE requirements and make sure that we're all safe. But mostly it's just making sure that we're retaining our valuable home health aides and keeping them working and happy, especially during this time.
Yeah, and so would it cost, I mean, we touched a little bit on it, but doesn't it cost the state a little bit more to have the person in a facility rather
Sure, sure. Right, and it sure does. If if the state were to kind of concentrate and kind of, we could look at it as it's saving them $30,000 basically per client per year in the long term. And Bayat actually has done some study on this, and that's what we found. So 30,000 per client per year is huge. compared to going into a facility, going into a nursing home, for example. Um, so yes, that is a big difference. Um, and like I said, more than ever with COVID-19, we want to stay home. We feel comfortable. We're home with our families and we're home. We're safe in our environment. And I think that's what people are looking for. So if the state looks at it that way, it's definitely worth it. It's worth the conversation.
And tell me a little bit about your grandparents. I know you've been working with them a bit, as well as the home health agency.
Sure. So my grandparents actually have been with Bayada before I was even in the with the company. So it's just like destiny that I'm here now. Um, and they're definitely at the stage. My grandfather is in his 80s, and my grandma is almost there too. And their health is deteriorating now. So it is extremely important for our family, especially since we do work. And even during this time, we have been working to have that support for my grandparents, to have that home health day there basically Monday through Friday to help them with their needs, especially like I said, as their health, my grandmother's vision is deteriorating. And my grandfather is having difficulty walking, just basic everyday needs. So for us, it's a blessing to have them in their home. And in this case, their one home health, they had been there for 9 years, Nellie. She's part of the family. She's been part of our family. So we're so grateful for her.
I can identify with that too. We have my daughter's aide is just amazing, and it breaks my heart that she won't be there as much as usual. And it's hard
Right.
to find. It's really hard to find a reliable person to bring into your home and care for a loved one as usual.
Absolutely. As building that trust. Recently, Nellie unfortunately hurt her ankle, so she's been out for a while. But we feel that we have a replacement, but it's that trust that Nellie has built. She's part of the family, and you can't replace that. And that is so important in what we do in pediatrics and in adult nursing. What we do in Bayada here, that is building that connection with our clinicians and with our home health aides. It is so important. And I think it's what kind of sets us apart, and because we're so passionate about it.
Talk a little bit more about what Bayada does offer.
So we're home care. They offer pediatric services. They offer what we call state programs, which is our Medicaid program that we're talking about today. There's also home care, private assistive care. They also offer skilled nursing, which is through Medicare. As well as rehabilitation services, a little bit of everything, but we do concentrate in home care.
Right now, the state, I know that things are happening with Governor Murphy, and certain funding is being considered. Can you talk a little bit about that?
As of Thursday, September 29th, we are really excited that the governor has passed and has actually increased the rate, which is fantastic. And we really appreciate the legislators and the governor for moving in that path and hearing our stories and hearing our voices, not only Bayada employees, but our families, our clients. So they did listen to us, and we are really thankful for that. But it doesn't stop here. Minimum wage will continue to increase in New Jersey in the next couple of years. Until $15, right? So we need to continue revisiting the rates and continuing to look into the future. So Bayada, and other agencies could keep their doors open, especially like now, like I mentioned earlier, with the cost of PPE that was unexpected, right, this year. And just like, and keeping up with the wages, we need an increase, a gradual increase. To continue, so that conversation needs to continue. It's not going to stop today. It needs to be a continual conversation in the future.
So as the minimum wage raises, state funding also needs to raise to help the disabled, because the direct impact is the disabled and the seniors of our community.
Sure, yeah. We need to, be able to provide the service, and the way to provide that service is to keep up, right? So we need to keep up with the wages and the changes. And also, besides just keeping up with the wages and changes, our home health aides deserve this. Sometimes they're undervalued. I want to say they don't have that voice, maybe that to reach out to a level, legislative level. So that's why we are so dedicated to that, especially here in Vallarta. We want them to be heard, but we value them, and we want them to know that we do value them. So this is a way to do that, is making sure that we are able to receive those increases, so we would be able to help them on the wage side, and I think they would appreciate that. I think we are their voice, and we need to, especially during the COVID pandemic, 19 pandemic. I think we need to really focus on that. They have been there this whole time, taking care of our family in their homes. And in our community here in North Hudson County, they're taking transportation, Uber, walking, and we forget about that. Like, they're risking themselves as well. So we are forever grateful for all of our clinicians, including our nurses, but especially our home health aides as well.
They are angels. I feel that way.
I agree.
And then, so what is the solution? How can people help? Anyone watching might want to advocate as well. What do you suggest?
Sure. Contact your local government, contact the state, send emails, call Governor Murphy, and let's continue with this conversation. There are, home care associations that are out there too advocating. Contact us in Vallarta if you have any questions. I'm sure we would love to help and guide you in the right direction. But definitely just get the word out there, talk about it, share it on Facebook, on social media, but definitely contact your local government and your state government. I think it is just crucial that we're getting our word out there and that they are listening, which I believe they are, obviously, with the current changes. But we need to continue this fight. And especially, I would say, to those who have loved ones who need home care, not only the elderly, pediatrics, young adults in general, they need the help as well. We always kind of think about our older population, which of course is, vulnerable population, and they need the help as well. But there are more people who need home care. So we need the families to get out there and make those calls as well.
Well, thank you so much for your advocacy and all that you're doing to help get as much funding as we can for this program, so that the seniors and disabled have the care that they need, and the families need the support. So thank you so much for joining us, Michelle.
You're welcome. Thank you so much for having me. It was a pleasure.
Thank you for joining us for this segment of Storyline. I'm Patricia Trenchak. Join us again to find stories like this that impact New Jersey residents.